Hey, this is Chris Beyer.
Hey, this is Chris Bowling.
We are CV Squared. So, Chris, we wanted to spend some time talking about what we know the highest performing programs and benefit plans get right. And we're going to have several videos over the next few weeks talking about the topic of the employee experience of healthcare, the challenges that we've experienced as our own users of healthcare. As advisors, we still have to deal with the healthcare system when we go in. And as we're going through that challenge, I mean, it's not simple to understand what happens when you go to the doctor. It's not simple to understand what happens when you use your ID card. Like I said, the best performing plans get it right. So as they deploy all these different tools and all these different programs, it's simple for an employee to understand that has to be the number one thing. What have you experienced, Chris, in your healthcare journey where you'd say, man, this is just confusing. I don't get it. And I do this for my job.
Yes, I mean, I've been doing this 30 years. My wife is a nurse. She's been doing that for about the same 30 years.
Yeah.
And both of us have similar experiences where it's so easy to get lost in this
Yeah.
thing we call the healthcare maze.
Yes.
My wife fractured her shoulder. We have a $3,000 HSA, goes to the orthopedic. They want to do an MRI. Of course, they've got this convenient MRI right downstairs.
Right there.
And, we're looking at $3,000 out of pocket. And again, I mean, my wife is a nurse. I mean, she works in the health systems
Yes.
and was going to walk right downstairs. And I said, have you thought about looking at the cost of this MRI, dear?
Right.
Because, we're in a pretty good sized town and there's multiple places to go.
Yeah.
And no, it never even crossed her mind. And 0.5 miles down the road was the exact same MRI for less than half the cost.
Yeah.
And, it's how do you make this convenient? Or better yet, no matter what tool you put in a employee's hand, how do you encourage them to want to look at the cost and being a good consumer? So yeah, that's just one brief story of someone who's very educated around healthcare that
Still gets lost.
she didn't know. I mean, she just followed where their doctor wanted them to go. And of course they own that MRI as well, so there was obviously some revenue coming back to the
right. They're running a business.
Yeah. And I know you have had a very similar experience as well.
Yeah, it's I've had experienced 18 almost 20 years working in the benefit space. I don't have the luxury of having anybody in the medical space within my family, but I feel like I have a good idea of what goes on. And it was still a challenge. We've got some family history of some issues that we know could possibly be passed on to me. And so it was maybe a year and a half ago, I started noticing symptoms that I know others in my family have had. And I said, man, I've got to get this checked out. So it's trying to schedule time with my family doctor. And that was 2 or 3 weeks out. That was even before COVID. And then he says, well, you've got to get into a specialist right away. And in my town, they referred us to that hospital group that's got a good specialist. But I said, wait a second, like, how do I know that this person in my hometown is the best at treating this condition?
Good one.
Because I've got a family member that went through major surgery to fix this problem. We had to go to the best of the best in the country. I was like, not that this doctor is bad, but they don't know what's going on. And then we started talking about all the scans and the different procedures that would need to be done to evaluate me. And it was, we have no idea how much that's going to cost. I would called the clinic, called my insurance company and asked, I need help. I've also got that HSA plan.
Right.
Oh, we wouldn't be able to tell you that. We don't know. I mean, that was the result I got. And, ultimately made a trip to another state to the specialty hospital, went through and met with that same physician that had worked with my family member. And we found out everything was good, but that specialty clinic with that surgeon and that whole team cost less out of my pocket than it would have to have gone to the lower level specialist in my hometown. And again, that is confusing for me trying to work through that.
Right.
I got to imagine an employee whose job it isn't to deal with healthcare and benefits and their spouse and their kids. They've got to have that same challenge. So
yeah, so let's put this in common sense terms, right?
Yeah.
Your car breaks down. You take your car to a garage, a
Yeah.
dealership, whatever, and they say, yep, this is what you need, and you ask how much it costs, and they say, I don't know.
Yeah, we got to do it first and then figure out which, credit card you're going to pay with.
Folks,
Depending on if it's Visa or MasterCard, it's going to be a different price, but we don't know that until you get the bill later. I mean, it's just,
that
it's
is the healthcare system right there. You have no clue, but you need to have this done.
Yeah, but swipe your card either way. And I think our industry, as the advisor and the broker and the consultant, have done a disservice to employees as well. For years and years, let's just raise the deductible to save money, not realizing that that family may very well be spending a third or 40% of their take-home pay if they actually had to use their healthcare to its full extent. When you count premiums, deductibles, out of pockets, it's just not sustainable.
No.
So Chris, as we said, the best companies get it right. I know we were meeting with an employer just recently that they've done everything possible to bring in every cost saving measure, every potential lever they could pull to make their plan as efficient as possible. We were talking with their team and we heard, we as the HR team, as the benefits administration in this organization, are confused.
Yeah, that's scary.
And all of those things made sense, but it's got to not only be something that's going to get good results, but it's easy to understand for that employee and their family. And especially if, the people dealing with every day are confused, we know those families are going to be confused.
Yeah, no kidding. I mean,
so Chris, what's up next as we share our next topic, as we talk about the employee journey through healthcare?
Well, something that I'm extremely passionate about, because it really related back to my personal story, is that we're going to talk about the inconsistency of PPO pricing across your networks.
Oh, yes.
And then pharmacy is again, looking at the same drugstore across our entire Quad Cities, the price is different as you move into more affluent areas. The price actually goes up. Right. So, again, how the heck are employees supposed to understand this? But yeah, we're here to educate more than anything. So we're looking forward to next week's video, and we're going to talk about this because it is where our healthcare carriers are absolutely failing us. They're not doing what they should be doing.
Excellent. So we'll see you next week. Thanks so much.
See you, folks.